in your 1.1 and 1.2 groups, we've heard some reports of people who are getting vaccinated that have no patient front business. They don't interact with patients. They may not be the frontline worker that we think of as a doctor or a nurse who are getting vaccinated because they do still fall under the category 1.1, 1.2. For a patient who might be sick, lying on the table, who's not getting vaccinated, how are you guys, what would you tell the people who are trying to figure out how that's fair?
So we've tried to right-size that, of course, in terms of how we allocated vaccines specifically to hospitals. There are two significant points on this. One is that it's important that the hospitals be able to function appropriately. So while there are individuals who are not forward-facing, they are essential to the continuity of operations of the hospitals themselves. So the healthcare workers cannot do their jobs if the IT folks are not running the network, or that the folks who are in the background aren't doing their jobs. So on one hand, we totally understand and respect the forward-facing component of things, and we've asked all of the hospitals to prioritize all of those individuals who are patient-facing. And we have held back a portion of the allocation to hospitals so that, again, knowing that there will be a tiered approach in each of the hospitals that they've created, and that there are higher priorities than others. The hospitals cut into their own supplies for their employees to start vaccinating the highest risk outpatient providers, those who work in urgent cares and other respiratory care clinics, so that those folks could come to the front of the line so that they could be vaccinated as they're doing face-to-face clinical encounters. And we will continue to utilize that. The other thing to consider on that front is operational efficiency is one of our guiding principles, if you've ever seen that slide that we use with the subcommittee. And so the Pfizer vaccine comes in packages of 975 doses, and it comes in an ultra cold storage chain. So the hospitals have been tremendous partners to us in utilizing the vaccine because they have access to the right resources, and they're operationally very efficient at managing vaccine in ways that other partners just will never have the means to, because it's too big a volume and too complex a logistics process. So breaking those apart and forcing people into a situation to move the vaccine around more than it's already being done actually puts us at risk for wasting more vaccine. And that is the absolute last thing that we want to do. So I think those are the two most significant points on this, is that there's an operational efficiency component and a continuity of operations component as we try to protect the healthcare system overall, so that is there and available as we continue to see high levels of hospitalization for not only COVID, but all of the other things that people continue to experience.
Do you have any estimate for how many people fall into that category of working at these top two tiers but are not patient facing?
They're in the lowest tiers in actuality, right? So the top tiers are the patient facing. And so we did not collect that data across all hospitals, obviously. We worked with them to generate guidance and similar principles that they would use across hospitals, but we did not sort of micromanage that process in a meaningful way.
And again, I think just to highlight, I do want to highlight the roles of the hospitals here. And so as Alicia mentioned, we are working with the hospitals to ensure that the highest priority folks, patient engaging physicians, providers, et cetera, are being vaccinated first, which they have been. But I also want to mention that the hospitals have really stepped up during this pandemic. They've staffed the field hospitals, and they're also they've been the first tier to administer the vaccine. So the fact that we've administered and been able to get out the vaccine so quickly and efficiently, and we're sort of, tops per capita in terms of vaccinated, that's a large degree also due to the hospitals and the fact they've been able to coordinate logistics, that they've prioritized this. So in general, they've done a really phenomenal job vaccinating their staff. Again, there's thousands of people as part of some of these hospital systems, of course. So I just want to acknowledge that in general, it's gone really well in the hospital systems today.